Yeah. So again, welcome everybody to the second lecture of our lecture series, The Healing Arts, Encounters in Arts and Medicine. My name is Anne Berghöfer. I'm one of the hosts from Charité University. Just for everybody who is for the first time here in the lecture hall this evening. So I first of all want to thank our two musicians. Where are they? Gone? We are already behind the stage. Jule Kloketa and Alexis Kunz. They are both medical students from Musik macht munter, which is an initiative of students at Charité to make music together for patients, for the staff, and for themselves, just for fun. Well, I also want to thank everybody who sent reflections about the last lecture. I got a lot of texts and reflections and summaries about the last lecture. And it's too much to quote everything, but I found just a few excerpts from the texts here. Sophia, first of all, gave a feedback to the start of the lecture. The first session of the Healing Arts seminar somehow began very intensively for me. I had an emotional, stressful, and long day and arrived in the lecture theater in a mediocre mood. When the guitar piece was played by the student as an introduction to the session, I became quite emotional. The guitar playing and the piece were so moving for me because it totally grounded me again. It reminded me again that somehow, somewhere, everything will be okay in the end. Marilyn wrote, in my reflections and through the impression of the lecture, however, I realized that the biopsychosocial model of health should be significantly expanded by the dimension of culture, especially through art. It is therefore far more than a decorative accessory. Marilyn asked herself what the prerequisites are for actually being able to experience art and benefit from it. Is the experience of art a question of knowledge or rather of feeling? How can we organize our society in such a way that the sensory experience and emotional response to art is not suppressed but encouraged? What actually prevents us from being moved by art? Then Christine wrote, I was particularly impressed by the example of a former ballet dancer with Alzheimer's disease. She was played the music from the piece in which she once performed on stage as a dancer. And although she could barely communicate verbally, she began to move to the music as if she remembered the choreography. I was really moved by this scene. It showed in an impressive way how deeply music is anchored in the brain, especially in the limbic system and in long-term memory. Music not only has an emotional effect, but can also activate cognitive processes that seem to have been lost. And finally, I want to quote Luisa. She also referred to this video example. On a personal level, the event touched me deeply, although I would naturally like to focus on new scientific art historical findings. She further wrote to me, one approach that was particularly important to me as a cultural scientist and art historian was that the museum space needs to be more open. People often come to the museums and think they need some kind of prior knowledge. The museum is far too often perceived as an elitist space, which is not really meant to be. To conclude with the words of Miss Lopez van Gool, you should feel at home. So this is for the moment, just to remember the last session. And now I hand over to Lukas Feireis, who will lead us to this actual session.
Thank you, Anna, and good evening, everyone, and a very warm welcome to tonight's edition of the Healing Arts Encounters in Art and Medicine here at the Charité Medical Center in Berlin. My name is Lukas Feireis, and I'm very honored to be your kind of host and moderator for the conversation. So this series was initiated, and you referred to this already last time, Anna, actually in the autumn of 2023, in collaboration with the International Society for Arts and Medicine and the network Art and Medicine here at the Charité, during my visiting professorship at the Berlin University of the Arts. As a space to bring together voices and visions from the world of art, medicine, and science. That said, I'd be curious to quickly read the room here. It's beautiful to see so many people here again. How many of you are from the Charité? So that's like again, medical background, working in the medical field, and artists among you? And maybe more on the kind of curatorial, as you know, art's hard to define anyways, but more in the creative sector realm. And kind of, curation or just curiosity. Neither artist nor medical professional. Wonderful. What are you guys doing? Ah, hey, Hinza. One I recognize. I know what you're doing. You're a connector. How about you guys? You too. Sweet. Okay, beauty. But then if I saw this right, it's almost half-half from like an artistic background and a medical background. That's similar to the experience we had in the previous two editions at the UDK, when the beginning was mainly art students, because we did it at UDK, and then over the course of the semester, it became like a 50-50 mix. So the combinations that we have here on stage of medical professionals or professionals in medical science and artists or, you know, cultural producers is also reflected here in the audience, and that's very beautiful. So make sure that you kind of connect here amongst the rows as well. There's a lot happening here, but there's even more happening probably in the row that you're sitting in. So our goal here is to explore how artistic and medical practices intersect, how they might learn from one another, and how together they can contribute to individual and collective healing. And as someone working at the intersection of contemporary culture and transdisciplinary education, I have long been fascinated by what we might call Wissenskunst, complementary to Wissenschaft, a form of knowledge that does not only follow linear logic, but embraces intuition, complexity, and creative speculation. And this kind of knowledge does not claim to be the objective truth. Rather, it acknowledges ambiguity, contradiction, and the richness of experience. And the arts can engage with the human experience in ways that scientific methods often cannot. And they should not be seen, as someone said in the comment that you just read, Anna, as something decorative or just the nice to have in healthcare, like, you know, hanging paintings in waiting rooms or playing background music. Instead, they should be recognized as important and necessary, as an essential element in healing, not just physically, but holistically, because they address dimensions of well-being, emotional, social, spiritual, that medicine alone often cannot. So tonight, we are very fortunate to welcome two guests whose work truly embodies the spirit of this series. First, Professor Dr. Benno Brinkhaus, who has been a key figure in advancing integrative and complementary medicine in Germany and beyond, a specialist in internal medicine with qualification in naturopathy and acupuncture. Professor Brinkhaus leads the university outpatient clinic for naturopathy at the Charité Campus Mitte and serves as the deputy director of the Institute for Social Medicine, Epidemiology and Health Economics. His scientific work bridges evidence-based medicine and traditional healing approaches, building a robust foundation for interdisciplinary care, and patient-centered research. And Benno is also kind of an OG in the Healing Arts series because you were here in the very first rendition of it. Also in a very, very inspiring conversation with Edna Bonhomme at the time. And we've met through our engagement in the International Society for Arts and Medicine and the founding of it. And now to you. Our second guest, Cristina Bucardo, comes from a very different yet deeply connected world. Cristina is a Mexican artist, sound healer, and teacher of traditional rattle practices. Her work is grounded in the indigenous healing knowledge of Curanderismo, a holistic practice passed down through her family. And she weaves this tradition into contemporary forms of artistic expression, including sound-based installations and performances. Cristina's practice is not only about healing individuals, but also about restoring spiritual and cultural connections, particularly in a diasporic and translocal context. And the connection to you, Cristina, because I like to make the connections where how did we actually meet is through you, Danny, sitting up there, because he will be one of the speakers the next couple of weeks. And he introduced me to Ola Kolahut. I don't know if you're here, Ola, right now. And when I sat down with her, she runs the Joy Space, she said you should meet with Cristina shortly after we sat down and met. And then I invited you to this series of talks. And actually on Sunday, I participated in one of your ceremonies and I was deeply moved. So I did my research. Yeah, with both of them here tonight, we are invited to reflect on the many different forms that healing can take. What does it mean to heal, not just the body, but also the spirit, the imagination, and the social fabric? And how can medical knowledge and artistic practice speak to each other in meaningful ways? We will begin with brief 15-minute introductions and thoughts from our two guests, followed by an open conversation and hopefully some time for questions and exchange with you all. So thank you so much for being here. And with that, let's begin. Benno, the mic is yours.
Thank you, Lucas, for the kind introduction, and hello, good evening. Dear colleagues, dear students, dear artists, dear friends, thank you very much for inviting me to give this lecture today as part of the lecture series, The Healing Arts. In my lecture, I would like to present parts of my work in the field of complementary and integrative medicine. And I'll also give lectures on placebo and placebo effects at the Charité. And in my talk to Lucas before this meeting, he was very interested in that and said, oh, please present something about that. And I will do that today. So I will emphasize also the importance of placebo and context effects. And at the same time, my work was influenced by the art of Joseph Beuys, whose work has always appealed to me and whose expanded concept of art has also inspired me to take a broader look on medicine and not only on conventional medicine. Zeige deine Wunde, show me your wand, is an installation by Joseph Beuys from 1976 and is located now, today, in the Lenbach House in Munich. The main object of this installation consists of two pathology stretchers, above them two little boxes made of sheet iron with shards of glass, which are coated with fat. Underneath the stretchers, two thin boxes filled with fat, each containing of a clinical thermometer and a test tube with bird pests. Next to each glass jar covered with gas. Two tools, shapsters, made of iron with wooden handles leaning against the white wooden panel. And on 2 black display boards, Beuys has written in calc, "Show me your wound." For me personally, this work is a major work by Joseph Beuys, who, by combining different medical utensils, education aids, such as slates and working materials, refers to a sensitive approach to illness, death, and dying. The artist himself explained his room installation. "Show me your wound," because you have to reveal the illness you want to heal. The room speaks of the illness of the society. A dynamic decision-making situation is depicted. The artwork does not stop at the wound. It also contains hints that the rigor mortis can be overcome. Something is created that, if you listen carefully, points to way out. I studied medicine, firstly in Vienna, then in Düsseldorf. And the study of medicine is, of course, many of you know that, very school-based. There was lots of content to learn. And there was little time for space for creativity and freedom of thoughts. And by the end of my study, I was exhausted. How lucky. I was living in Düsseldorf, and there's a famous Düsseldorfer Kunstakademie. For me, a place of creativity, freedom of thoughts, and spiritual and mental action. First, I attended lectures, then seminars, and then drawing courses. And I finally decided to switch to art after my graduation. But that didn't happen. In the last year of my medical studies, I started my practical year. And that's when I began to enjoy to practice medicine again. I started then at the university in Friedrich-Alexander-Universität in Erlangen, and I was trained as an internal medicine doctor. And I was lucky enough to join a working group in which I was able to study naturopathy, complementary, traditional medicine. And I can learn to do it together. We had a university outpatient clinic on complementary medicine in Erlangen, and we gave lectures also, and we did studies. In 2001, I came to the Charité, and we conducted large acupuncture trials. And after several years of research in the field of complementary medicine, I became a professor of complementary medicine in 2010. Since 2007, we have also, and Lucas mentioned that before, we have also an outpatient clinic on complementary and traditional medicine and prevention. To the background, approximately 60 to 70% of the German population use traditional medicine, mostly for chronic and functional diseases. We in Germany have a relative liberal system with treatment pluralism. So physicians have the therapeutic freedom, so they can treat with different healing methods without any problems if the patient agrees. In Germany, the classical European medicine, the naturopathy, is the most frequent used complementary medicine therapy, with, for example, herbal medicine, with exercise, nutrition therapy, relaxation, and healthy lifestyle. Other traditional methods are manual medicine, acupuncture, Tibetan medicine, Ayurvedic medicine. Okay, danke. We demand for an integrative medicine, a combination of conventional medicine and scientifically based or informed complementary and integrative medicine. In our view, health promotion is an important part of medicine, for example, to strengthen people so that they stay healthy. Or if people are ill, then we should take preventive measures to protect them from the progression of the disease. We see the combination of conventional medicine and complementary medicine as an opportunity to build a modern medicine. We have to remember that more than 50% of the world's population does not have any access to conventional medicine. They are dependent on traditional medicine. Also, therefore, we should actively investigate effectiveness, efficacy, safety, and health costs of traditional medicine. In integrative medicine, doctor-patient communication and interaction is of a crucial importance. This is also referred to in what I consider to be very important study by the scientist, the US scientist Ted Kapchuk. It's a friend of mine who carried out several clinical studies with a so-called placebo needle. You see the needle on the right-hand side. Normally, the acupuncture needle penetrates through the skin into a deeper layers of the skin. In contrast, the placebo acupuncture, you see in the middle, back into the shaft, also, as is also the case with the theater knife. So Ted Kapchuk performed a randomized control trial in 262 patients with a chronic functional disease, irritable bowel syndrome, and he divided into 3 groups. The first group was a waiting list group and received no intervention. The other 2 groups received placebo acupuncture, as you see on the right-hand side, with one group receiving only limited communication and the other with other extensive communication. And you can see the result for the symptom severity here in this figure. The group with a detailed communication was significant better than the other 2 groups. Communication was crucial for the success of the intervention. There are many other studies that show how important communication and empathy are in medicine, but not only in medicine, of course. We often speak to the so often called placebo effect. But it would be better to speak about context effects or meaning effects. Why? Because the effects are depending on different characters, and it's shown here. This figure shows which factors are important for the success of the therapy, in addition to the specific effect of the intervention. You see, there's one, the characteristic of a treatment, for example, the color or size of a medication, the patient for himself, expectation, for example, the practitioner, of course. If the practitioner don't believe his own treatment, it's not so very stimulating for the patient, then the patient communication relationship and also the healthcare setting. Which are the psychological mechanisms are important in the placebo or context or meaning effect? There are 2 main components. And one is the conditioning, unconscious learning through repetition, and also, of course, the expectation. For example, if you have a high expectation, the treatment success is really higher. And the brain structures are also known and are shown here on the right-hand side. For example, in the brain, the insula, the amygdala, and the nucleus accumbens. Ich bin noch hier unten drauf gedrückt.
Hier ist so.
Ja,
Das ist ja merkwürdig. Du warst auf Seite.
11.
Hier.
Noch eins weiter, ja. Okay. It is also known that the placebo or context effect activates various neurobiological mechanisms depending on the disease in question. For example, pain activates the endogenous opioid system, while Parkinson's disease activates a different system, the dopaminergic system in certain regions of the brain. So you can see other diseases, and a placebo has different actions in different diseases. In this context, I would like to draw your attention to the book I like very much, entitled The Lost Art of Healing, Practicing Compassion in Medicine. It is written by the well-known cardiologist Bernhard Lawn, who is concerned about the loss of communication, technical skills, and empathy in medical examinations due to the increasing mechanization of medicine. By concentrating on the technical aspects of modern medicine, we are losing the art of healing. And that's one of the fundamental aspects of medicine. We are losing the healer and replacing him with physicians who interacts more with computers, with artificial intelligence and machines than with patients. Joseph Beuys was an international well-known German action artist, sculptor, draftsman, and art theorist. He was a professor on the Düsseldorfer Kunstakademie, Art Academy. His work dealt with questions of humanism, social philosophy, politics, and of course also anthroposophy. It is interesting to note that Joseph Beuys also saw himself as a health worker in the sense of the expanded concept of art. A quote from 1973 says, in this context, I would say, what I practice can be transferred directly to medicine without further ado. Art as therapy, the artist as therapist. Beuys says, I practice medicine. I was fascinated by the art of Joseph Beuys, his sculptures and objects, his performance actions, but also in particular his sensitive drawings, which very often describe existential human situations, pregnancy and birth, illness and dying, death and return. I discovered the book you see on the right side, Joseph Beuys and Medicine, with text by and about Joseph Beuys and with important works in this context. In 2007, I habilitated in the subject of internal medicine and clinical epidemiology. My lecture topics at the inaugural lecture was Joseph Beuys, Methodologic Pluralism in Art and Medicine. Joseph Beuys' approach to medicine was influenced by anthroposophic medicine and shamanism too. He aimed for a spiritual medicine beyond the materialistic world. Man, as a spiritual being, must heal. That is more important than materialistic healing. Beuys contrasts classical materialistic concepts of natural science with an expanded definition which he calls the plastic or the social plastic. Natural science is supplemented by a subjective, non-rational approach, which we negate in our Western concept of natural science. Beuys said in 1970, actually, arts as I practice it means that actual natural science, I wanted to practice it. The fact that I took little pleasure in an isolated positive concept of science led me to seek out the plastic, which we should be added to the positive concept of science. In this way, the expanded concept of art and the expanded concept of science in one fell swoop. Every human being is an artist, said Joseph Beuys. Everyone processes creativity, which they must use to release in order to activate their resources. He contrasts this concept with a classical concept in which art is an elitist concept, you see on the lights, left side, that can only be practiced by experts. Through the expanded concept of art, both artists and creative people as artists have a lasting influence on society. I am convinced that modern medicine also needs people who actively promote their own health, strengthen our own health resources, and live in harmony with themselves and the environment. According to the concept of salutogenesis, humans are on a continuum between perfect and good health on the left side and limited health and illnesses or death. Health promotion is a central concept of salutogenesis, meaning the activation of human health resources to maintain health and ward off illness. In the modern world, many factors influence us, some of which we can influence ourselves. For example, healthy diet, healthy exercise, relaxation, or only some of which we must endure, such as acute stress or chronic stress. However, we can try to deal with stress in a healthy way by strengthening ourselves with self-care interventions such as meditation, yoga, qigong, and others. We can apply this concept of salutogenesis also to our planet, to the Earth, which is negatively affected by various factors, often influenced by humans, including dependence on fossil fuels, monoculture, deforestation, and overuses of fertilizers. We need to strengthen the world's health resources, for example, by preventing the plundering of nature, sustainable use of energy and natural resources, and prevention of environmental pollution. Our existence is threatened. The human existence, the existence of our planet Earth. Beuys depicted this oppressive situation in a way that I found very impressive. In the work Schmerzensraum, hinter den Knochen wird gezählt, Pain Room, Behind the Bones is Counted, from 1983. The room is completely covered with LED panels. A light bulb on the ceiling sparely illuminates the room. Next to it are two rings that are about different sizes. The head circumference of an infant and an adult, respectively, birth and death. The lead room protects against radioactive radiation, but it also isolates people. What is needed, says Beuys, is warmth. And he adds, there's no question in mind. The time bomb is ticking. Everything is so ossified that hardly any movement is possible. Yes, it's only behind the bones that we count. The watercolor sheet im Haus Schamanen, in the House of Shaman, is the earliest known work with shaman in the title, and it was created in 1954. The figure of shaman served Joseph Beuys as a projection screen for themes that were of fundamental importance to his entire oeuvre. Formulated easily early on his work, they culminated in his ideas of social transformative tasks of art. The figure of the shaman manifests the non-rational spiritual forces that Beuys wanted to use as a counterpart to the dominance of the materialism that, in his view, characterized today the Western worlds. In summary, for me personally, medicine is closely linked to art. I believe that art is existentially important for the individual as well as for the society, for our planet. As long as there are people, there will be medicine. And as long as there are people, there will be art. Art and healing belong together, or healing and art. With reference to the highly recommended book by Eric Kandel, Das Zeitalter der Erkenntnis, The Age of Insight, The Quest for Understanding the Unconscious in Art, Mind and Brain, I would like to thank you for your attention.
Thank you so much, Benno, and thank you so much, Lucas and Vanessa, for the invitation. I would like to start maybe with showing some sound. Okay. I'm going to start by showing a piece of my sound production I do in the rattle cleansing ceremonies. Can we put a bit more up? Okay. And for this, you can close your eyes for a moment. And you can do some deep breaths in and out in your own rhythm. Deeply inhaling, deeply exhaling. And as you exhale, you're going to release control. As you exhale, you're going to release resistance. You're going to feel more and more present here into the space. We're going to connect in how are we feeling today. And just listen to the answers with a lot of acceptance. And as you breathe in and breathe out, in your natural breathing rhythm, we're going to imagine some roots going down from the bottom of our feet and connecting us into the Mother Earth. When you're ready, you're gonna do one last deep breath in through the nose, and then you're gonna exhale very deeply. And then you're gonna come back slowly into the room. Okay, so this was just an example of my work. This is currently what I do here in Berlin. And today I'm going to show you, I want to guide you through my work. So first I'm going to guide you into the roots of my work. That is the Mexican traditional medicine of Mexico. And I want to give you some examples of the rituals and ceremonies that we do in the Mexican tradition. And then at the end, I want to show you more about my work as an artist. So this photo is really meaningful for me because this was the first ritual that I ever do here in Berlin. And as you can see in the images, like people are really connecting. You can see the expression in the face. I remember for this ritual, many women of different ages came. And what we did was a cacao ceremony. So it was a nice memory for me. And for you to understand my work, I really want to guide you first to the Mexican traditional medicine. That is a system of healing based in the ancestral knowledge of the indigenous people of Mexico. In Mexico, we call it the medicine of the people, la medicina del pueblo. So this what it means is that it's a medicine that is accessible for everyone, regardless of their economic status. In Mexico, the healthcare system is not the best, and not everyone can access to clinical care. So for many, the Mexican traditional medicine is really, for example, myself, I practice because of my cultural tradition, but for many communities, they practice for practical necessity. It's really like the only knowledge that they have. But it still continues to be very relevant because how it works is that it integrates natural remedies, spiritual practices, and the most important thing is that the intention is to balance the physical body, the mental body, the emotional body, the spiritual body, and then to connect also with the community and with the environment. So it's the connection of the nature is a really important layer in this practice. And here I put some photos to illustrate if you've never seen this practice before. Here is a beautiful image of curandero. Sometimes we call this medicine Curanderismo. And here we can have see a curandero that is cleansing a woman with some herbs, some plants. Here we have an indigenous ceremony. It's called La Primera Fiesta del Elote. It's a ceremony of corn, and we can see a woman that is using candles and that is using some smudge. Some smudge, okay. So as I mentioned, it has indigenous and pre-Hispanic roots. And the most important thing to remember, I think, is that we use very primitive tools. We're talking about the use of fire, the use of water, the use of smoke. We're talking about plant medicine like copal, tobacco, cacao. We're talking about obsidian tools. We're talking about more herbal bundles, instruments that are made from clay or from wood. The main instrument that I play here in Berlin is the rattle, and I think this my work is really known because how I play this instrument. I create some sound journeys for the people that are sometimes between 60, 90 minutes, and I only play this instrument for 60 minutes. This causes in the people to enter into a deep state of relaxation and of meditative state. And here we have the first illustrations that we had of pre-Hispanic traditions in medicine from the Códice Florentino. And as you can see, we're using plant medicine, we're using some textile, some massage in the body. This is an image that I really love. It's from Diego Rivera, and he was the husband of Frida Kahlo, and it's called El Curandero. And this image I really love because it portrays all the tools. We have the plant medicine in the back. Some of the main plants we use, for example, are epazote, ruda. Then we have the fire, we have the water. Then we have some eggs that are normally used to cleanse the body, the spiritual body. Then we have some salt, some water I already mentioned, and some textiles. And currently in my practice, these same tools are the same that I continue to use. The only difference that I do is that I create also my own artistic expression through this practice, but the original tools are the ones that I continue to keep. And here I really love this image. I think it's really cute because we can see the toddlers from a very young age already learning about the healing practices, studying about plants, and then repeating within the family. So something really important is that this practice has anthropological roots. So this means that it was created when the knowledge was passed within the family, generation after generation. And it was really important as well, what was the relationship of the community with the agriculture? What plants were available, what tools were available. And so in this Mexican traditional medicine, in Mexico, then you will have different variations as well, because we were colonized by Spain. Then we also have more influence from Cuba. Then we have more influence from Africa. This is like a really, really wide tradition. And myself, I also, the reason why I started this tradition is because through my mother and through my father, in my family lineage, I had traditional healers, starting from the grandfather of my dad. He was having like clinic or a temple, you can call it. It was really coming from a marginalized community in Mexico, in Pachuca, and it was like, I know that the space was completely white, and he was using herbalism, and basically just like his hands, more like Reiki is known today, to heal the persons. And the people in the community was paying to him with chickens and with animals. So this is a bit of the story, also how I arrived here. Of course, I have had other teachers like Sergio Magaña. I studied in the University of New Mexico with Cheo Eliseo Torres, that is also more into the traditional medicine. And here I put these traits of traditional healing practitioners. This, I think, is really relevant, and it's also, it has the similitudes with Western medicine. So the first one is that we have the ability to recognize the imbalance, but not only in the physical body, sometimes also in the non-physical body. Then we are guardians of traditional wisdom. We really try to keep the roots alive. As I shared to you, I really try to keep the basic tools, the original tools in my practice. And then the third one, community caregivers, obviously, because they guide the ceremonies. And the fourth, they are really connected with the nature and obviously with ritualism. So something special about this Mexican traditional medicine is that all the healing practices are either rituals or ceremonies. So this is an important statement. All the healing practices are rituals and ceremonies. So what is a ritual? It's a simple repeated action with purpose. And here I put you, now I come back to this slide, but here I put this image to illustrate. This is in my practice in Joy Space, the one you know, Lucas, from Ola. And this is normally what I use in my sessions. I have some symbolism like the corn, I have some candles, I have the eggs, I have the copal that is burning. If you don't know what is the copal is a resin of a tree, it's like the blood of the tree, and it's part of this ritual. And the most important thing for me about what are the benefits of the ritual, because of course they reduce anxiety, it can help the emotional processing of the patient, But for me, the most important is that it triggers a meaning response. So this means that the individual has a space for them to give a meaning to his own suffering, for his own pain, to whatever experience they're going through life. This is a space where they find meaning and where they can also create a bridge between the unconscious and the conscious through object, through visualization. And yeah, so for example, just to give you an example, but what I do in this session is I always start like asking to the patient, what would they like to release? Because this is a ritual of energetic cleansing. What would they like to release? And sometimes they choose something, for example, of the physical body, like I have pain in my arm, but sometimes they also choose something symbolic, like I am having a trouble with this relationship, and it's more like it's more about symbolism as well for them. It's a therapy that is really reaching the patient in so many levels. And the ceremony, well, is the same thing as a ritual, but here the difference is that it's a shared healing experience. So when you are in a ceremony, we have a communal intention, we have a shared intention in the space. So here, another example of a ceremony that I do is the cacao ceremony, Temazcal. I mean, only if I am in Mexico. And here also some of the benefits. It helps reframe illness, to give the meaning of why they're experiencing this. Very important, it creates social bonding and also a connection to community. And another example more in the physical body, it activates the parasympathetic nervous system. So here I put this photo of a temazcal. This, if you don't know what it is called a sweat lodge. And we can say it's like a sauna. It's like a Mexican sauna, but it has indigenous roots. This is in the house of my mom. My mom and my uncle, they guide this temazcal in Morelos. And how it works is as well, like you enter in community with a group of people, then you have the curandero that is guiding the whole ceremony. And as I said, you have a group intention for what we are working there. So just an example here, I put the cacao in some ceremony. I just want to hear what I want to explain, because I think I don't have enough time, but it was that in this practice, all the bodies are rich, the physical, the mental, the emotional, the social, and the spiritual. So in the physical, you can see it has, when you drink cacao, well, you're receiving magnesium, it helps you release endorphin, it also helps you in the circulation of the blood. In the mental, well, you're entering with an intention, and it's also like a meditative experience. In the emotional, you express, you're processing your emotions. In the social, well, you're entering with a group, so it's a sense of community. And in the spiritual, it's about a connection with the environment and life. Here, I want to also state that in this tradition, when we are talking about the spiritual body, what we are meaning is like, what is the relationship of the individual with himself, with the community, and with the earth? Like, is he finding his purpose in the 3 layers? This is what I refer with spiritual. It's more about the connection of nature. And here I put you more example of rituals types that I do, the temazcal, the limpia, the cacao. Ritual de cierre is, for example, when someone is coming through a loss or through a process of grief, we create also a ritual of transition for this moment. Then there is also Ceremonia de la Tierra to connect with the earth. And then you can see the dimensions they are reaching. I mean, some of them are only reaching the spiritual and social, but some of them are really reaching the whole spectrum and all the dimensions of the health. Yeah. And here, just to close this this part of the introduction of the Mexican traditional medicine, this is really important for me because all my work is based in this model of balance as a practitioner of healing, but also in my own art. This is the ancestral model of balance of the traditional medicine. And long story short, how it works, it's called Nawi Olin, is that it's guided by the 4 directions, north, west, east, south. And this you will have this similitude in actually in many cultures around the world. In Canada, they also have the connection with this medicine wheel, this medicine circle. At the end, what it's reaching is about that the human being has 4 points of integration to find balance. So just to give an example, for example, if one woman is coming and is feeling really depressed, that it happens, many women come with depression to my session. I know that she needs to work with the south because the direction of the south, and that is the blue color, and that is the element of air, is where you find your meaning of life, your meaning in your work, your meaning in your relationships. And so this is also my gut, like if she's depressed, okay, I know I need to create a ritual that has the element of blue, it has the element of air, etc. And this is also really relevant in the art of Mexico, because in the art of Mexico, there are many, many arts that are based in this circle. For example, the sacred dances. The sacred dances are following this movement, so the dancers are creating some cross or some circles around this symbol. And here you can see in the Anthropology Museum, this is the Aztec calendar, and the Nahui Olin is in the center. So it's also related with time, with many things. Okay, so now just to make a bridge to my work. This is my work. My project is called Mitotili. It comes from the Nahuatl Mitotli, that means sacred ritual and ceremony. And my intention was exactly to bridge all of this, so to bridge ancestral wisdom and then bridge cultural tradition and also my own expression of art, because I also come more in a design background. I also went to university to learn sound design, art direction. So I wanted to create a project that really integrated all of my knowledge in this and art and design, but also all my knowledge and passion about Mexica philosophy. Here are some rituals. These are more myself doing traditional rituals in Mexico. This is one for the earth. This is one. This is a Mayan baptism. In the Mayan baptism, if you're curious, is introducing the baby to the 4 elements. And here I am in Berlin in my practice in Joy Space, and then we are in the park. Also, I think we were like 30 persons, and then I'm playing some traditional instruments like the rattles, the rain stick. And then, here I wrote from traditional healing practice, because this is what I try to keep, and then to contemporary expression, because then at the end what I do with also the knowledge that I have of sound and everything is to create a more contemporary expression of the pre-Hispanic music, or it's also my contemporary expression of a ritual. And this is the end. Here I just put you the first flyers I do for my events here in Berlin. And I was doing in Joy Space, holographic healing nest. This is more recent, where I am giving some workshops of how to use rattles in healing practices. Then Círculo de Mujeres is women's circles. And then I wanted to, it's not possible to play the sound with the, but also with the visuals. It's possible or no? With the visuals, it's true?
Where do you want to go?
One more back here. Remove. Can I try? I want to put just an example in the sound that sounds a bit more contemporary. Yeah. And then I'm just going to show you some example of the rituals I currently do here in Berlin. And here I just want to close with this reflection of my dear Kira. She's one of the participants in my rituals and my ceremony. And she's currently here in the Charité because she's going into a cancer treatment. But she also, can I remove the head? Yeah, Kira, she's going through some cancer treatment here in the Charité, but she was also coming before she was having her, ¿cómo se dice? Chemotherapy session. She was also coming with me to have her own ritual that was meaningful for her. So I asked her to share some words for us today, and this is what she shared. In Western society, we lost our connection to ritual, but your work is a living reminder of the sacredness we each carry within and the power of ritual to restore balance. And yeah, that's it. Thank you so much.
Thank you, both of you. We come now to the second part of the evening, which is the conversation. I'll break the ice by asking a few questions, but it's then really about us kind of, engaging here. I'm very moved by both of your talks, and I'm so excited that we're creating the space. It's not a given, honestly speaking, that the two of you would be sitting on the same stage here. And I'm very excited about such like first-time moments. So I wanted to sit down as well, maybe for the moment. There's a lot of connection points that I drew. I'm sure you also found many when listening to the other. I maybe start with the last thing that you mentioned and a key point that you had too, the power of rituals. No, you just ended with this quote. And there I see a common denominator in both of your reflections today, in the sense that you both raised the question in how far like ritualistic elements and actually also aesthetic elements in healing, whether they are clinical or in a clinical context or in an artistic or like healing context such as yours, enhance therapeutic outcomes. Yeah, by whatever, by shaping perception, expectation, or beliefs of such things, no? So you brought in this idea of the context effect, which I found extremely fascinating. We even made these 5 points of it. Like the setting is important, the aesthetics of things is important, the practitioner is important, as well as the patient. And what was the communication? And the communication between the two, that the whole thing is not transactional, but relational. And this is basically at the core of what you just presented. So maybe both of you, from your standpoint, kind of could elaborate on this idea and on the connections that you just heard of the other. And since you have the mic, you can start, Cristina.
I can start. When I was going through this presentation and thinking how to explain ritual, I was reading actually a lot about placebo effect, because I also wanted to find how to explain to you how it works. And for me, yeah, at the end, I found that a ritual, it has obviously a placebo effect, so the people give meaning to the objects, and I tell them, for example, this ritual is gonna be good for you for this, and the people really are taking it, the ritual very serious for them, and therefore I really see physical improvements. Like, for example, I see women that really arrive completely depressed, and I see them one more after we have 2 or 3 sessions, and they're a new person without having medicine or anything. But the word that I, at the end, I chose to say was not actually placebo effect, was more the meaning response, because I think I felt more connection and more resonance with this. And I saw you were also mentioning this. But it was very interesting for me to listen about the context as well. This I didn't explore so much.
So we have a lecture about placebo. I think it is a 90-minute lecture here for the students. And I think this is a very important concept, because you can distinguish between the specific effect of a treatment and the other effects, we have to say. However, I would like to say more the meaning effect, because that's the meaning what it is for the practitioner, is for the patient, and it's not so negative. If you speak about placebo, we always think in a negative way. I think meaning response or meaning effect is much better. And we know, for example, in acupuncture treatment, there's about 75% of the effect in pain diseases is unspecific, is meaning effect. 25% is we have a specific effect, but it's smaller than the unspecific effect, the meaning effect. And this is always a discussion, because the placebo response, the response of acupuncture is normally higher than a medication, but it's not so specific like a medication. So the conventional medicines say, okay, the specific effect is small, and therefore it should be not paid. However, the overall effect is important. The meaning effect is very, very important. And I found very interesting that children also learned something about traditional medicine, and they learn also about the meaning effect. That was quite interesting for me, that children in Mexico are very used to learn this, like our children were used to go to a pediatric doctor and get some medication. So it's also kind of meaning effect that we learned in the conventional medicine.
Yeah, thanks for sharing the mic. But that's a large number. You said 75% versus 25%. That's for acupuncture. Are similar studies or findings also done with classical medicine in the Western way? And what are the results? Because
it depends on the medication. But no.
And how do you, before I give the mic to you, or this, thank you, Cristina, how do you really distinguish between these specific and so-called unspecific effects? And just for the round, so we're using the word unspecific effect, meaning effect, or context effect, or placebo effect, like synonymously in this conversation.
Yeah.
But how do you
normally in the science, you do clinical trials, and you compare a medication to a placebo, medication to placebo, and you have effect, a higher effect of medication normally, and a smaller effect for placebo. And the amount, if you take the placebo effect away, you have this specific effect. So that's a normal method for clinical studies. In the acupuncture, you do a placebo acupuncture, as I showed here, or you do a sham acupuncture. So you stick the needle, but not very deep and not at the acupuncture points. So you can distinguish between a real acupuncture session or a sham acupuncture, also Scheinakupunktur. And you can then distinguish the effects of specific effect and the non-specific or the meaning effect. And the meaning effect of acupuncture is really big, because you have also the contact to the patient. You make a pulse and a tongue diagnosis. You speak along to the patients. Maybe you have also nice music in the room, and all these characteristics have an influence of the result.
Which brings me maybe to the second topic, and then I will open also the mic here. Before coming with more is, we had the ritualistic aspect, and then now also the relational one that you just brought in, which was also one of the points mentioned before, meaning the relation between the patient and the practitioner, or between the doctor and the patient. You stressed that quite heavily, and I think that also came very clearly through in your presentation, that the healing, quote unquote healing now, we're using it a little bit, anyways, for the evening, quote unquote healing happens often in the space between people. No? So can we look again at how you guys understand the relational dynamic between the healer and the patient, or the participant, as also maybe a key component of well-being? I mean, we've all probably had the experience that you felt really seen by a doctor, or you come to a praxis or a healer, and sometimes you really feel, okay, this person really looks at me and it really does something to you. So maybe for you as an artist and healer, and for you now as a medical professional, your take on this relational dynamic for the final outcome?
Yeah, for me, I mean, if I can share it like completely personal experience, is that what I notice when I'm giving my treatments like this 1-1 is that when I have a better session is when I really are able to connect with what is, with the pain that is going through my patient, like to really. And it's funny because you also mentioned about the compassionate part. Is like just a moment of connection. There are days that I am unable to connect with the suffering of the person, and therefore I feel that the session doesn't go as the best. And the days that I'm really present and really I'm trying to listen to the story and to put myself in the shoes of the person that comes with me is when I feel is given a better meaningful result in the ritual.
And did you also get the feedback from the patients?
What's that?
You just described that you feel differently, but have you ever also received this feedback from the patients that they felt more connected when you were connected?
What I received from the patient, no, but because I think this is something, as I said, really personal. It's not that I try to look like very compassionate into the story. I try to look also with distance, but it's more about how I also give symbolism and importance to what the person is going through. But the feedback of the patient, yeah, I mean, there are persons that obviously they don't always connect to my ritual. This is a reality as well. And it's also, I feel the same. It depends really in the relationship and what is created in the space. If it's able to become an intimate space, or maybe there is not a connection.
I think in our medicine, if you go to a normal doctor and you have a cough or like this, a normal doctor has maybe 3 to 5 minutes for you. So he sees you, ask you 2, 3 questions, maybe make some examination, and then you get some medical device, and then you go out. And I think we are really happy in our outpatient clinic, in which I do lots of acupuncture, where we have more time. And the time is important. The time you take for the patient and also for the relationship for the patient. So when I treat many patients with acupuncture, but the relationship is very important. And you can build a relationship. So if you make maybe 10 acupuncture sessions, you have always the possibility to have 10, 15 minutes to speak to the patient and to ask him again, what will you change? What have you changed? Are there any other things? And I've mostly a better and better contact at the end of the routes, and I really know much better the reasons for the disease. I see the patients 10 times, for example. I think it's very important to have time. And I think that's the great problem in our society, that we have no time.
And probably also
relationship.
And probably also a case for modern healthcare, which is very protocol driven, let's say time constrained and transactional, where the example you just gave is probably an exception from the rule to have this space. So my question would have been, how do you create such spaces? But you just gave a great example. And for you, maybe again, Cristina, because what you do create, even in a ceremony with many people, like I experienced on Sunday, is that without knowing people in a very short moment that we share together, you create a relational intimacy. Can you share a little bit how you do this or what your experiences are?
Yeah, actually, I wanted to also add it to connect to the other point. But for me, it's really important as a practitioner to always be very connected with my intuition. I think when I put the slide, I put #1 trait of a practitioner is that he is able to find imbalances, physical and not physical, But also what I wanted to say, what I meant was that it's very important for the practitioner to be connected with the intuition. And I think this is also very important in the Western medicine, as you say, like sometimes you will find tests of your patient and you're unable to, there is something more. And I think it's a really important trait to be connected with also your inner wisdom, with your, to trust your own knowing. And this I want to connect it now to the ceremonies, because what I do in each session, because each session is completely different. Sometimes come 30 people, sometimes 10, sometimes everyone is coming with a heavy energy from, from Neukölln, like, and other times people are really nice. It changes every week for me. And for me, the most important thing at the end is to be connected to the intuition, so I can read the energy of how the people are feeling, like how can I guide them? What is the energy? What is what is the communal energy? Because the ceremony is a group, but it's really important for me to be connected with myself and to read. And I think in art, for example, a DJ is also doing the same, right? Like when he's playing, he's also reading the crowd in a way. He's really connecting with his own art. Did I answer your question?
I think it's a very paradox in our healthcare system that we pay lots of money for pictures in CT, also computer tomography, and you almost see no doctor. They make pictures of you and you pay lots of money, but we are not paid for time. So in Switzerland, there's a system that you can say, okay, I take 30 minutes with a talk to my patient. In Germany, it's not possible. So if we get no paid for speaking, it's not done. So it's a very strange situation, I think, because the time for the patient is the most important thing, I think.
It is a moment I have a bunch of questions still on my sheets here, but I see already the first question coming up there. And there's one too. Actually, I'll start here. It's easier, it's closer, and then you, okay?
Thank you two so much. It was really interesting. Oh yeah, I will. Yeah, my name is Roja. I'm a design student at UDK. I'm doing my master's project about waiting spaces for doctors, so it's a really interesting combination. And so I found very interesting you two talked about like salutogenesis compared to pathogenesis, what makes us healthy, and like the holistic approach, cosmos, how everything is connected. I wonder what conclusions should we draw from this for society, for medicine, and maybe even more specifically, if we would have like, if it would be utopia, we would have all the resources, time, money, space, and so on. What could we do to create everything more holistic, like in medicine and the arts generally? Like, what would be your ideas? Where should we head as society and in medicine? Yes.
Schön, dich zu sehen. Benno, you guys, the question is to you. You have to answer. I'm walking just around to find new questions.
Okay, I think this, I draw at the end a conclusion, and I think what I said is that art and medicine are important existentially for man, for human being.
And you have to speak up. Has it been like this the whole time?
Yeah.
You should say something.
No, but
You have to speak much louder.
it's very separated in a way. It's not inclusive.
So you have to speak louder or turn the sound. And you have to speak much louder.
Okay, so for me is as I sum it up at the end, for me, human being exists only with medicine and also with arts, and it should be linked more closely, and it's also important for our planet, for the universe, I think, and we should bring them more together. I think that is what I hope that we can do. Maybe this is a conclusion.
Let me think. So what was my conclusion of this? But something I realized when I was preparing all of this, because I was sharing my family, for example, that I come to share here my work, they tell me no, but for in a medical perspective, they're not gonna take it seriously. But as I was producing it, I realized at the end, like this medicine is arriving to your physical body, like we have the proofs of the cacao, for example. It's doing something for the physical, for the mental, for the emotional, for the social. Only there is like the last layer that maybe is the spiritual that is not taken so much in consideration. But I believe this practice continues to be very relevant and should be integrated, in the Western medicine, if not as a complementary, I don't know if I'm answering the question. Not so much.
I think for me it's very important because I also perform lots of traditional Chinese medicine. And what's interesting is that also in the Mexican traditional medicine, the energy is important. And not only there, also in the Tibetan medicine and the Ayurvedic medicine. However, in the Western style, we have no link to energy. Go to a doctor and say, I have no energy. He cannot do anything about that. And that's a real strange situation. See the post-COVID situation. There are so many patients and they say, I cannot sleep. I have no energy. And it's very difficult for the conventional medicine to even diagnose this, and more difficult to treat it because it's an energy problem. And there is in the Chinese medicine, also in the Mexican medicine, there is the possibility to treat low energy or to treat unbalanced energy. And it's so important. And it's very funny if you go to a colleague of mine, say, yeah, what do you say about energy? He say, how can I measure it? I cannot measure that. It's very strange.
Good evening. Thank you to both of you for your presentation and also for the organization of the event. I have a question. My name is Georg. I'm a medical student, sorry. And I have a question regarding medical education, actually. And I was wondering, so I feel that we are not really, at least here in Charité, we're not fully prepared, let's say, to take the most of the placebo effect. What I mean by this is that most of what we learn is targeting the specific effects of everything. So the standardized treatments that are the same if person A or person B does it, and every time of the day, at every time of whatever. And we don't really have placebo courses. I mean, I think actually we have in some way, because there are communication courses that we attend, which I think is very good. But still, I think it would be nice. It would be very useful. So not only nice, but useful to teach to young medical students how to leverage this effect, like the meaning response, or how to also activate the healing forces that are inside a patient. Because I mean, I think there are many I don't know if you could call them diseases or imbalanced situations in human life that you can only hear yourself, and there won't be any molecule probably that will really help you. So my question is how we can address this on a medical education level, firstly, and secondly, how, and because probably, I mean, obviously medical education is mainly guided by what later on will be paid for by the Krankenkasse. So how can we make the Krankenkasse pay for more time, like you said? So, and that's why I wanted to have this question also for you, Professor Brinkhaus, because is there evidence in any way convincing Krankenkasse that, for example, lowering blood pressure or anything like this can profit by more time, by something, let's call it unspecific or meaningful? Can you measure this? Because I think the people that decide on money in this world, they need numbers and images. So is there a way to put this in numbers and images so that we get what we want from them? Thank you.
Thank you very much for, I think, very important questions. I think the first question to the
Lauter nochmal musst du.
to the
Also der Sound ist echt nicht so dolle. Also echt richtig laut müsst ihr reden.
regarding
Speak
the
up really loud.
education, we have, of course, one lecture, 90 minutes in M20. But I think there are so many informations and data and results in the last 10 to 20 years about placebo and meaning effects. It's a completely new stuff. And I think we should broaden this in our education more. And, you know, when I start to give the lecture, I said, you will learn, it's undependent if you are a pediatrician or an internal medicine doctor, or this is important for you, but not only for you. I think that's also important for human beings, that the communication, the art of empathy is so important for all other business too. It's not depending only on medication or in a medical system. And the second question is, yes, we could try to bring it in. However, the problem in our healthcare system is always the money. And if we pay the doctors for minutes, if we pay the doctors for minutes, it's very expensive. And we have to change our value system, you know, so that the machine doctors gets lower and the speaking doctors gets more money. It's finally always about money. That's a problem. And in Switzerland, they did a very good decision, I think.
I just want to add to this. I mean, I don't have the studies of the placebo effect, but something that I was thinking, if you are not able to get it through the medical education, I just wanted to add that I think it's always, you can always have the opportunity to practice compassion with your patient. Like, for example, when a nurse is arriving in the hospital and she has the little table, you know, and she has all the tools, this for me is a ritual. It's already, she can also practice a ritual there. How will you become this space with the patient and the nurse a ritual? It has to do the attitude of the nurse introducing each tool and explaining each tool to the patient, you know, how it's going to work in his body, and always like practicing, yeah, just empathy and care. And maybe we cannot include it in the medical program, sorry for studies, but you can always start to practice, I think, if you're already in this path.
Hello, my name is Rainer. I'm artist, architect, and educator working the last 20 years in the field of academia. I have a question in regard to the word integration. Professor Brinkman, you were using this word, I think, in one of the foils, integrative medicine as a kind of cross area between conventional medicine and the rest, including traditional. Also, with my academic background, I know it's quite difficult to bring different methods together. Sometimes it's very difficult because these methods, they come from different, even belief systems sometimes. And Cristina, you also said that it's important to kind of, you know, bring it to contemporary forms. In the same time, when we use traditional knowledge, this traditional knowledge is also anchored in context. So, you know, people who know these traditions, they live with it. They are part of the belief systems, right, of these traditions. So now suddenly we have to bring this into a new context. And I don't know, people in Germany, they are quite rational, I think, also, and they have other beliefs. How do you think is this integration possible? Is it only possible when we convince people that they have to take different belief systems that do not fit together, but still say it works, even if something is not compatible? Or how does that work, the integration?
as I said, I think 60 to 70% in Germany already uses some kind of traditional medicine. So we have this both medicines together, but mostly the physician don't ask the patient, what do you do else? Go to acupuncturist or homeopathist or manual practitioner. So we have two systems, and of course we are variationalist more in Berlin than in Bavaria. In Bavaria, it's more the people coming more from the traditional of naturopathy than here. I think it could be complementary. So we have conventional doctors and we have other doctors, and I think they could work together and should not ignore each other. I think that's the status at the moment. They ignore each other. And I think that's not the right way. And I think we can say integrative medicine. I think for me important is to make a better medicine. It's for me, the term, is it integrative medicine or real medicine or whatever, comprehensive medicine, that makes no sense. But bringing that together in a tolerable way, it's very important. I make research since 30 years in complementary medicine, and in a rational medicine like Charité, you only convince with data. You know, that's results, and we adopt 60 clinical trials or like that. And I always try to convince with data. That's the only way. However, I think we can have also other like traditional medicines, and we should also explore them.
Yeah, at the end, I was just going to mention something similar, but at the end, I think that how it integrates into the city, because I've been doing this for almost 6 years in Berlin. Sorry, fix that. More close, okay. Is that at the end, this is a very multicultural city. We have cultures of everywhere. And I think that sometimes the Western medicine that is practiced here in Germany is lacking another level of care. Maybe it's the energetic, I don't know. But people are really looking into other medicine, into the traditional Chinese medicine, into the Mexican. So it's not, it happens really, it's been happening really organically. Like people are looking for, maybe it will work for them. As I say, sometimes they like the rituals, sometimes they don't. But the people are really curious. They want to explore, and it's part of this city that is really turning so multicultural. It's part of the growth of this city. At the end, it happens organically.
Yeah, good evening. I'm Insa from Berlin, and I'm the founder of the Healing Culture Network. And I just want to get back to you, Georg, and I just want to mention that what you were talking about, or what you are seeking, I think, is the field of health humanities. And this is established already 20 years ago in the UK. And now we find it also in Canada and many other countries. And it's the integrated arts, encounters and medicine in the curriculum. And it really works that way that medical students go into the art institutions that cooperate, and they work with arts, and they also do storytelling, they do acting, dancing. And it's not only about, or it's not, the goal is really to get connected to yourself or within the team, because arts open a space to also to understand my feelings or my borders and my the unperfection parts of me. And this is kind of the basis to be kind of a human doctor in a way. And so this is really the field of health humanities. And if you're interested in this, maybe you want to start this here. And I think that it's really a good idea and good practice. And it's then secondly, of course, the relationship to patients and the families, of course, they participate and they benefit, but it's not the core. Last week I was in Prague for a seminar in a way, and we were connected to one person from a Canadian museum, and he was also talking about that this is really now in Montreal at a university for medical students. This is daily practice in a way. So maybe this gives you some ideas to develop this here in Berlin. And then another thing with the Krankenkasse, there is a huge and growing body of evidence, also in numbers, that it really, there's a social return on investment if you connect with the arts and medicine. So I think also this, we don't have to start to develop those studies all over again. We can actually refer to data. And third point, I think we heard a lot of the term healing, but also medicine. And I think it's really about living a good life and not to get ill. So I think the question is really, what is medicine in the future? And I understood you both that it's also the self-responsibility of everybody and of society to really care for staying healthy. And if you become ill, then it's not the end. Maybe it's another way to live, also with a chronic illness or knowing you have to die in a week or so. Yeah, thank you that I have the opportunity to share this with you. Thank you.
Do you want to respond?
I think medicine reflects very good the society and also our economic system. And we are living in a very capitalistic system, and the medicine is similar to the health to the economic system in which we live. And I think we have to change our thinking for getting another society, and then we can maybe change also health system. And not only in the rationalistic way. I think that's our both talks about.
I'm a medical student, and I have a question regarding the idea of having infinite empathy with the patients, especially when you're on your third night shift, you haven't eaten, nobody's having empathy with you, especially the system. How can we also talk? I feel like we never talk about the other side, that maybe empathy has to be a two-way street, or there has to be a system that takes care of the physicians too, because physician burnout rates are skyrocketing. More and more people cannot work. And sometimes when we talk about this very nice ideas, it seems like you have to be a superhuman to have so much empathy with everyone and be such a good doctor on all levels, the spiritual, the physical, looking at all the pictures, all the diagnosis. It seems like how does this work in the time frame that you have, in the reality, when I have to start with the payout in like a year? How can I integrate this without driving myself into a burnout, or in this idea of fixing a person completely without taking care of myself?
You know, as I started studying medicine in Vienna and in Düsseldorf, we have no communication tools, nothing. Especially in Vienna, you can study in Vienna medicine in former times, 5 years, and you have no contact to patients. And I think that has been changed fundamentally. I think you have the communication tools more and the interaction more. However, it should be trained more, I think. And I think you can train empathy in each conversation you can do. Not only with patients, with friends, with family, with the normal people on the road. I think the training that is the communication training doesn't stop by patients. That's my feeling. And you have to train that, and you will receive a lot, I think, if you're trained in empathy.
Yeah, I just want to add to this that, yeah, I mean, I am not a doctor, but I feel you, because also it's the same for me. I cannot practice, infinite empathy all the time. Of course, I am having difficult days sometimes. I'm going through personal things and I must show up there. But something I've learned is that at the end, if this is like your passion, it's also important to take responsibility of that aspect in yourself. So, of course, it's not easy, but I think it's a really important part in any practice. And it's a responsibility to you yourself find your own ways to feel better. Maybe you can have your own therapies, maybe you go to Pilates, I don't know, but have your own practices that help you also release all the stress when you're noticing that you're not being the best in your work. I think it's just a responsibility. I don't know if I answered the question.
We have 4 more questions, just looking at the time. Yes.
Yeah.
Number 1 of them.
Thank you for your warming words and presence. My background is in clinical psychology, different therapeutical modalities, and bridging the art and science of well-being. And I have more personal, professional question to both of you. And how much do you want to know, you need to know about the stories, the narrative, the biographical data of the people, and how much you connect to your sensing and perceiving bodies? And how do you integrate these 2 different, or like more than 2 different modalities? I think you already mentioned a lot your energetic body and how you do it. Yeah, I would like to know that.
For me, it's very important. As I said, if I do acupuncture, I have this chance to speak for 3-4 months every 2 weeks with the patients, and I'm very interested in biographical data, and that's important to understand why the patient is like he is, and it's always difficult to find the core elements, of a disease. You can try that. So, for example, I have a migraine patient, and after the 6th or 7th acupuncture, they told me about the bad relationship to the partner. But the first 5 sessions, I have no information. But then there's this trust, and for the patient to me, and I think then and it opens an eye, or a migration patient who has a loss of her father, and it's not she has problems with that. So sometimes the solution, or like if it's a solution, comes very late. It's not at the beginning clear for me. But I think it's always interesting also for me to hear these stories.
Yeah, for me, it depends, because, for example, some patients, they come with me and sometimes, for example, they don't want to share. Even I have cases that they don't want to share their names. So it's just like an anonymous ritual that I need to practice. But at the end, for me, the most important is just to know the most basic thing is not actually where they come from or the cultural background. It's more what they want to treat, what they want to release, and how are they feeling.
First of all, thank you for both of you. It was like really inspirational and a lot to take in. I'm Jem. I'm a nurse since 10 years, and I work since 5 years at Charité at an intensive care. And it's not a question, I just want to share my insights. So at the beginning of this year, I was like diagnosed with burnout.
And so what led to this was like what you, Professor Brinkhaus, mentioned. And it's like the sad reality of this health system in Germany, because with the lack of time and like also with the lack of empathy, which concludes it, it leads to the situation where we are. So we can help or heal more people if we have more time, or like if we could like focus more on that. So yeah, it was also like a response of you. So we have to change the whole system, because the nurses don't have time, the doctors don't have time. So yeah, we have to change the whole system, and yeah.
You may add to it, third of the fourth question.
I think it's more common. I agree. I think it's more common what you did, or is it? We had a question about that? Or? No.
Thank you so much for your contributions. I'm observing a lot of focus on medical education or medicine, and I had to reflect for a moment there that although the arts are framed as something positive for the reception often, and for example, what we saw last week, that arts exhibitions can be organized so that also reception is perhaps more integrative of the whole human being. I had to reflect that sometimes art education is also capitalistic and competitive and focused on the individual and not connected to others, so that we don't, sorry, my background is art. Obviously, no. I mean, it's interesting that there's art therapy or music therapy, but that in art education, there is also not necessarily a focus on community or how you connect as an individual to another individual. It can be a lot about, okay, how you develop your craft and how do you conceptualize your work, or but it's also about the career and getting famous if you can and things like that, and some meaning. And there's hierarchies and there's egos and things like that, which I'm sure you know from medicine as well. And I find it interesting, it's, I guess, more of a comment also than a question, that perhaps the arts in education could also be taught that they can be healing, and maybe there's something to learn there for art students and artists later as well. Thank you.
Thank you for this one.
Is there in the art academy, for example, in Berlin, is there a topic about healing?
So the sound is actually really bad, I have to say. So I didn't hear what you just said.
Yes, okay.
We got to work on this one, by the way.
But yeah. But why the healing? It's not a topic normally for art.
And there's art in context, but that there is an aspect of it, I think it's mental health more than physical health, medicine. Yeah.
But a good reminder. And our last question.
Pressure.
Loads of pressure.
I'm Laura. Good evening. I was called cancer survivor last year, and I am still getting used to calling myself an artist, since I use art as a healing mean for myself. My question, though, isn't about my very own case, but about my mother's case. And to give you the question essentially to start with, how do you mend a broken relationship with the healer? My mother has a very rare degenerative disease, and she went through a decade of medical wandering before she got the very first diagnosed. So by the time she actually got to have a first treatment, she already got completely disappointed and lost faith in the medical system. So this aspect of relational trust belief system that you mentioned, once it is already broken, how do you fix that? How do you move forward?
Thank you.
It's a good question. I have no real answer. I think it's you know, as I was a physician, I worked on the oncology ward. There was a doctor, and he standing in front of the patient, and he said, we diagnosed cancer to you. And he said this in 5 people standing around, and the people have not the chance to sit down.
And with the mic really close.
And you have not the chance to sit down. So it was so impressive for me, and that was a university hospital. But I think it's very, very difficult to find good doctors with good communication skills. Yeah, I think we have to train them more, Friederike, at the university. We are on the way, but I think it will take a long time, even because many conventional doctors don't have the feeling that the time is important, that the communication is important. I think that's also the problem. I think we have to change our thinking. That's the important thing. It's the only thing. As I said, I think the medicine at the moment reflects the society in which we live.
Yeah, I mean, I'm sorry this relationship was broken within the doctors and your mother. I think, yeah, this is a very difficult situation. But from my personal experience, because once I also had like a small tumor that I need to treat, I went to 6 different doctors in Berlin until I find one and that I could connect. It was not easy, obviously, because as you said, you break the relationship. It's very difficult to trust again. But at the end, we need to understand that, for example, if your mother needs more like a clinical doctor, the Western medicine is the only way to cure the physical body. There are many different therapies for the mental, for the emotional, for the spiritual, but maybe for the physical, it is important that she gets a treatment for that. And I hope she don't lost hope, but I think she can build trust again if she continues. I mean, in my experience, I hope.
Thank you. No, you keep the mic. Looking at the time, and I see there's even more questions in the room after 2 hours of a very intense and very intimate debate. We come to understand once again, like we often, that there's some serious need for systemic change in many fields of society and education, whether it's in the arts or whether it's in medicine, whether it's in humanities or it's in science. And that's why we're here for. That's why I create the space and the stage here. So I would like to use this opportunity to thank you, Anne, Vanessa, Jakob, for organizing everything, Benno, Cristina, amazing presentations today and a beautiful conversation. And a big applause to all of you for coming here and joining this open dialogue. So thank you very much. And as I said in the very beginning, I tend to do this in all the type of events that I host. Make sure that you talk to your neighbors. I mean it, like not only the ones that you came here with, but you know, we're leaving this space. We'll be probably standing outside for a couple of minutes, like engage in a conversation. No, that's where really the connections happen also between the encounters between art and medicine that we try to foster here.
Yes, with empathy.
And genau, and practice empathy, you know? So again, thank you very much and see you, I think, in 2 weeks, you know, for the next session. Oh, and for all the students, sorry. If you need ECTS points, you have to come down here and sign up the list. If you want to be in our newsletter, also come down here, analog, and write your email address in there or telephone number.
Die Flaschen gar nicht aufgemacht. Aber es klingt auch. Jetzt nur
Oh, das hat super gepasst. Das Berlin. Ja. Aber das war auch das Vorbereitungsgespräch. Dann wüsste ich ja.